I recognize the member for Halifax Needham.
Thank you, Madam Speaker, and thank you for this opportunity to speak to truly what is, I think, the number one issue certainly facing this government and perhaps facing this province. We do spend a very significant, approaching 50% of the provincial budget on healthcare. And I think what we have seen with this government is that that money can be ill spent and cannot achieve the impact that it ought to. I want to make the point just starting out that I do believe that we are in a crisis. And I also think that that crisis was not inevitable. When my predecessor in Halifax Needham, Maureen MacDonald, was appointed as health minister at the beginning of the previous, anyhow, the government that came in 2009, the situation that she faced and that government faced was not dramatically different demographically from the situation that the province is in now. Yes, perhaps our population is skewing even older now than it was then. But the finances were not dramatically different. The infrastructure was not dramatically different. The panoply of different forces, from pharmaceutical companies to Doctors Nova Scotia to unions to on and on, that whole cast of characters who needed to be engaged was not dramatically different than what this government has faced. But I think the approach and the way that that goals were set and the way that strategy was arrived at was dramatically different. I think from everything I have been able to glean from speaking not just with the Honourable Maureen MacDonald, but also from speaking with people who worked with her, from speaking with people who interacted with her in the public service, from speaking with doctors who got engaged in thinking about our healthcare system during that time, there was a sense that the question of how to navigate a very difficult terrain was going to be arrived at collaboratively, respectfully, by seeking information and by engaging the people who knew and had a stake in arriving at the best path forward. And that is where this government, frankly, has really, really misstepped. Because to start out trying to fix a problem by disrespecting so many people who you need to have engaged in arriving at the solutions it's just a fool's errand. So a couple things that could have been done differently but weren't. Number one, negotiating the health accord. It is incomprehensible to me that a Liberal government with a uniformly Liberal caucus, Atlantic caucus in Ottawa, could not arrive at a deal that actually recognized the—
Order. The member from Halifax Needham has the floor.
Thank you, Madam Speaker. It is incomprehensible to me that a Liberal provincial government with Liberal MPs uniformly in Ottawa could not arrive at a deal that recognized the very specific demographic challenges that Nova Scotia faces in terms of an exceptionally aging, older demographic. It is 100% understandable that many people like to come home after working many of their working years elsewhere in Canada and live in Nova Scotia. That makes complete sense to me. We live in an amazing place, and sometimes the job market is really hard. But then it does not make sense, as even I believe that the Minister of Health in Alberta commented. It does not make sense then that when people come to Nova Scotia at the time of their life when they're pretty much inevitably going to need more health care than in their 30s and 40s and 50s, that is not in any way recognized in the financial deal for health care funding. So that's one thing that could have been done differently and absolutely should have been done differently, and frankly is going to hamstring us for years to come, for the length of that health accord. This is a challenge, and I in my role now, interacting as I sometimes do with various parties that watch government, including public servants, Nova Scotia has to get past the idea that a new government comes in and the first thing you do is you walk away from the work that was done by the previous government. It is an irresponsible misspending of the effort of public servants, and we pay them to do our work as a province. And the amount of work that went into, for example, arriving at the Collaborative Emergency Center model and rolling them out with a plan for how to move forward with more, for that to have simply stopped when this government came into office is so unfathomable to me that should be considered an act of fiscal prudence. It's not fiscal prudence. When you have wasted the effort, when you have wasted the work, when you walk away from the investment in time and energy and creativity and relationship building that arrived at something that was working, that was making things better. Sure, there is always more work to do. I know that in the NDP government, when first Maureen McDonald and then my colleague, the honourable member for Sackville-Cobequid were health ministers, they did not get to all the work that needed to be done. There was definitely a sense that, okay, we're going to deal with emergency room closures. We're going to tackle that problem. And they tackled that problem, and they moved the dial. And it wasn't easy. There's no part of, I don't believe, and I would never say that governing is easy. It wasn't easy, but it was carefully done, and work was done, and the dial was moved, and we were making some progress. And we walked away from that. The mental health strategy, which has been referenced multiple times today. People in community-based organizations, First Voice, citizens of Nova Scotia who have experience either as people who struggle with their own mental health or as people who love people who struggle with their mental health, were engaged in the process of designing the mental health strategy. And they were invested in its success. And again, this government kind of just walked away from it instead of building on that momentum. So I do think that we're in a crisis, and I don't think that crisis was inevitable. And really, I think the lesson that this government has not learned is one that was very evident in Cape Breton with the announcements of those hospital closures, that people will only support change that they have had a hand in crafting. If we do not, as leaders, make sure that we have some followers with us, we're shot before we start, and especially when the people who you are trying to lead have the skills, have the relationships, have the personal reputations in their communities, have knowledge that we need. We have to engage with them, or else the effort will not go well. And I do think that we're really paying a price, not just for like the specific decisions that have been made, but for the deep sense of so many people working in this system, working in the healthcare system, that they have been and are continuously being disrespected and disregarded, and not engaged, not invited to be a part of crafting the solution. I met this spring, shortly after the last session, with first some first-year medical students at Dalhousie, and then a medical student who was just entering her residency in family practice. In each case, the young professionals who I met with were, well, the first year students and the resident, they were all interested and had always been interested in family practice. All three of them from Nova Scotia, deeply rooted here, with families here. The resident, whose significant romantic partner is at Down Medical School, a couple years behind her, is leaving Nova Scotia to do her medical residency in Ontario. Why is that? Why is that? One of the quotes that I wrote down from that meeting was, "It's not the numbers." She was referring to how much money family practitioners make in Nova Scotia. "It's not the numbers, it's feeling like you're less valued." That is the feeling that that medical students and medical residents who are interacting with family doctors currently working in Nova Scotia, that is the message that they are getting from those family doctors, that they feel like they are less valued, that they have been devalued. In any professional environment, in any space that we have occupied in our other professional lives, we should know this, that people give us their best effort when they feel like we want their best effort because we actually value them. And that is the great mistake that this government has made. On a very practical level, we know that there are not enough nursing home beds. There just aren't. And we can wish that away, but we see the results backing up through emergency rooms and right out the door of emergency rooms into ambulances. And onto our highways where there are no ambulances available. To have ceased investment in new long-term care beds was folly. I think we can invest looking into the future with an eye even further into the future. We don't, this demographic situation that we are in is not forever, but it is for the next 20 years. We are not at the beginning of our aging population challenge. We've got a long time to go. And I think as a province and as a government, we have to at least commit ourselves to wanting people's last years as Nova Scotians to be years lived with dignity. I have been several times to the home of an elderly woman who has stage 4 cancer and some mobility challenges and is going blind and lives alone in public housing in a 1-bedroom apartment. And she wants to go to a nursing home. And she cannot because she is not ill enough. And I think something else that we owe Nova Scotians is to be honest about the state we're in. We are in a situation where we think it is okay that an elderly person who is palliative, who is getting palliative care, is not ill enough to go into a nursing home where somebody would be checking on her on a regular basis, where she wouldn't be alone. Yes, she gets lots of home care, but I think of her when we talk about how wonderful it is that, or when the Premier specifically talks about how wonderful it is that we have cut down the wait list for nursing homes. We've cut down the wait list for nursing homes because we don't let people get on the nursing home wait list.
Thank you.
And then for the people who are in nursing homes, we have made the situation for those nursing home administrators, for those nursing home staff so challenging that on that end of it, it is hard to provide the dignified care that people deserve. So I do think we're in a crisis. I look forward to seeing how in the 3 years that remains of this government's mandate, they try to pull us out of it. Thank you very much.